We begin tonight with a mystery.
The mystery of autism, the developmental condition that can affect the ability to communicate and interact socially.
We're beginning with it because the CDC is reporting a sharp rise in the number of children who have it, more than 3% of 8-year-olds.
And because today, the Secretary of Health and Human Services, Robert F. Kennedy Jr., called the rate of autism alarming and ordered up studies to determine the cause by September, something scientists have been working on for decades.
There are clues, but no conclusions. We're joined now by CBS News medical contributor, Dr. Celine Gounder. Celine.
In his first press conference as secretary, Kennedy vowed to come to an understanding of the causes of autism. Autism is complicated. It impacts the brain of both children and adults, and decades of research has not found a single cause.
The ASD prevalence rate in 8-year-olds is now 1 in 31. Shocking.
Health and Human Services Secretary Robert F. Kennedy Jr. pointed to new evidence that the U.S. is seeing, in his words, a growing epidemic of autism.
The epidemic is real.
CDC data shows 1 out of 31 children has been identified with autism. The previous report 2 years earlier found a rate of 1 in 36.
If the epidemic is an artifact, a better diagnostic criteria or better recognition, then why are we not seeing it in older people? Why is this only happening in young people?
The American Academy of Pediatrics has disputed Kennedy's characterization, attributing rising rates to the fact that more children have access to evaluations.
And I think there is more awareness, but clearly there's something else.
Teresa Hamlin has worked with teens and adults with autism for more than 40 years at the clinical and research organization, the Center for Discovery, where she's the CEO.
These are new cases, and there's more and more of them.
And how do you know it's not just better detection?
These are not kids that would have been diagnosed with speech disorders or emotional disorders. These are true kids with autism spectrum disorders, and you wouldn't have missed them.
Kennedy has for years promoted a link between vaccines and autism. That theory has been debunked. The secretary announced plans for new studies to identify environmental causes for the rise in autism rates, such as mold, ultrasounds, obesity, and diabetes. In his comments today, he did not mention vaccines as a possible cause.
And we're going to get back to with an answer to the American people very, very quickly.
Dr. Gounder, can you get an answer by the fall to these kinds of complex questions?
This is a very complicated question. What causes autism? It's multifactorial. There's genetics, there's environmental causes, there's other causes probably too. And to tease that out, the number of people you need to study over time. I mean, if you take, for instance, the example of smoking and lung cancer, that's actually a pretty straight correlation, and that took years, decades to prove that. So to sort this out for autism, not by September.
When it comes to potential causes that'll actually be studied, does that include vaccines in any way, shape, or form?
Well, it's interesting. He did not mention vaccines again during today's press conference, but he also said that he does not want researchers to feel constrained in terms of what questions they can be asking. The specific things he mentioned included ultrasounds, obesity, older age of parents, exposure to air pollution and plastics. So there are a lot of different things that could potentially be studied through this research.